Thank you very much, and yeah, it's actually great to be here. I joined NHSBT right at the beginning of the pandemic, actually. Took the opportunity after 20 years designing aircraft, lounges, meals, entertainment, all of that glorious stuff, to take a dip into blood donation, and arrived at NHSBT, and I'm really glad I have. And you'll probably guess I'm not a clinician, I haven't got a clinical background. I'm a marketeer, I like the fluff, I like the softer side of it. And for me today, it's been a huge learning exercise. So I've been Googling frantically as everybody's been talking, trying to connect the dots. So thank you for a great session so far. I'm also conscious I'm the blocker between lunch, so I will try and move at pace on this one. You should hopefully know who NHSBT is. I think the key point to call out here is that we do cover a lot. So organs, stem cells, tissues. We've got a really good clinical and research background. And as Sue highlighted earlier, we've got a pretty sizable donor base, 1 million blood donors, and we take 1.5 million blood donations a year. So fairly sizable, 6,500 staff. So it's a pretty meaty organisation. But what I wanted to cover today, just really briefly, is our NHSBT strategy. We launched it earlier this year in March 2022, and you'll see the strategy spans across the whole organisation, and it's great that we've actually come together as an organisation and we don't have individual strategies. There are service strategies that support these, but ultimately we come together as one to save and improve even more lives. Our focus more on the grow and diversify base, but don't forget parts around our modernise on our operations, drive innovation through genotyping, which we heard this morning, collaborate with our partners around building our plasma base, and investing in our people, which is hugely important. So again, hopefully some of this feels really familiar. I've heard a lot of it this morning already, so I think we're probably sharing a lot of pain, and problem halved is a problem solved, right? Like, it's quite nice to know that everybody is feeling some of the same pinches. But for us specifically, that need for rarer products is growing. We just heard the rate of the sickle cell increase here. Like, you know, we're feeling that from our side as well. We also need to change the mix and the volume of our donor base. So although we've got 1 million donors, it's just not big enough for us. It's not diverse enough for us. It doesn't accurately reflect the population and therefore meet the needs of the patients that we have. It's also not inclusive enough. So Sue's done an amazing job at making it as inclusive as possible for men that have sex with men, but we haven't really tackled some of the transgender opportunities that we've got, and think about pronouns and the wider diversity and inclusivity that's going to come. Changing public sentiment, this is, say, at the core of what I do, and that's the difference that we as public individuals now face as the likes of Amazon and Apple and John Lewis. You know, everybody is pushing that next step. The NHS app launching the COVID pass within months, within weeks. Everybody's so expecting of technology and experience, and our blood donors generally are no different from that. I get away, because I am still relatively new, calling out a few little bits and pieces, but when I rocked up to a donor session, it did feel like a bit of a wartime effort in one of our mobile sessions. And you know, I come from a beautiful first-class lounge to trying to give blood in a blood donor session. It's like, I get that there is a difference, but our donors should be getting a better experience than turning up to a mobile session with some plastic cups and unbranded squash. But that's just my soapbox. We need to tackle that volatility. Amber, unfortunately, was an issue for us. Yesterday we came out of amber, which was great. We dipped our toe in the amber water just very, very quickly. But we need to be able to react to that much better than we do today. And tackling the health inequality, which we're all here for. So I said I'd dive into the grow and diversify our donor base. This is around our team as primarily donor experience, but it is an organisational-led priority. But as donor experience, we're at the front end of that, bringing our donors in. And I'll share with you our plans really over the next 5 years, just at a high level, just a flavour of what we're going to be doing to tackle the health inequalities. You'll see here some of the key themes. deepen partnerships, collaborations. We've restructured our teams so we have a greater focus on community investment and partnerships. That's hugely important. As I said, just based on that research there, one of the key things that we know with our Black heritage donors is trust is the biggest issue for blood donation. And that's actually trust more generally within the NHS, not necessarily NHSBT, but there is a significant trust issue that does stop Black heritage donors coming forward. We've got loads of tech stuff that we need to do. I'm sure everybody underinvests in their technical infrastructure, and it's costly, it's time consuming, it's hard to get stuff done sometimes, but we've been able to carve out ways in which we can do that. There's been a lot of day-to-day, more than my brain can cope with, but we need to get to continue to leverage the data that we're getting, better understanding from a behaviour perspective, working with the BTRUs, but also managing that end-to-end experience. So what are the key moments that donors actually come back for? Is it the orange club biscuit that everybody seems to want? Not my flavour, but what is it that really makes our donors tick, and how do we get them coming back? Which is what all drives the experience, retention, loyalty, and that's why my team was newly formed when I joined. So, planning to diversify the whole base. As I've mentioned, we do have a sizable number of donors, but it is just too small. We ask a lot of our donors, so our average frequency is much higher than friends, partners around the world. And that's great in terms of we've got a really stoic donor base. Slightly skewed to older. I'll let you choose the line on older there, but white British donors that just keep coming back. That works, but it doesn't work for us in instability where we have the volatility today, because we've already exhausted our donors. So when we were in amber, trying to call for more donors to come forward and fill those appointments was just impossible, because everybody was at their max capacity as a donor. So we need to be able to grow that donor base so that we can reduce that frequency. The other challenge is donors don't want to not donate. We know that's going to be our biggest issue there. Even when we tell donors that we don't need them, they still turn up at the front door. So, we love our donors for that, but we've got to do better at managing that experience for our donors. And that's where we'll put our investment in some of the technology. You'll see there that we re-platformed our app last year, moved it onto better technology, gives us the opportunity to redo the user interface, the experience is better. We're seeing more people book from the re-platformed app and online experience. We're just investing in a brand new marketing tool, so marketing automation tool, so all of the emails that you get from most organizations are pumped out by some whizzy technology. We use less whizzy technology today, and we'll be able to transform that so it's much more personalized, engaging, and we'll be able to respond much more quickly to our donors. So there's a huge sort of technical piece that we're trying to build around growing that donor base, but primarily looking at managing the expectation. So when somebody signs up as a donor, we should be able to clearly give donors the expectation, AB+ females, unfortunately, you probably won't be donating that frequently. The demand just isn't there, but it doesn't mean that you can't stop donating. There's stem cells, there's organs, there's tissues. How do we broaden a donor's opportunity to be a donor? And I've talked about our older, and I'll let you choose the line on older, but we do need to start bringing in some of the younger donor as well. With our older donors, we need to have our eyes and ears wide open to at what point that donor base is unfortunately going to become no longer effective for us. At some point, that donor base will die off in its truest sense, and we need to manage that carefully. Not only think about how we let those donors leave our relationship and thank them for all of the work that they've done, but as the second point says, how do we bring the new donors back in? And this is where we are reactivating our schools program, particularly going back into schools and diverse schools to try and bring education as a way forward. And the last point there is around changing our footprint. So we've got loads of mobile sites across the UK and sort of 12, 15 fixed venues. They're probably not in the right place where we would want them now. Most of them are serving white populations in the UK. So we opened Stratford in London, in Westfield, beautiful shop, hugely expensive, but beautiful shop with donation for our donors, right in the heart of Stratford, which is a great diverse community. But it also takes 2 years to build that donor base to get that stability that you need. So we need to be able to be a bit more dynamic in our footprint, starting to look at other areas in London. Birmingham works really well for us, and Manchester also gives us some good diversity. So there's a logistics piece behind that. And then more specifically around ONEG and RO, so we do need to increase the number of ONEG and RO donors. We do substitute the RO blood, which we've heard is just not great. That's not what we need to be doing. So in order to do that, we do need to increase our Black heritage donors significantly. You may have seen, I mentioned about the partnerships and community investment teams that we have. We partnered with Black Panther last week, the film that will come out. Or is it out? Today. If you haven't seen it, go and see it. You'll see we've partnered with Disney on that, and over the last 4 weeks in the run-up to that, in the campaign and in our blood campaign, we've got 36,000 new Black heritage donors, with over 1,000 donated in the last couple of weeks. So, that is transformational. That's amazing to be able to start to shift in real scale some of the health inequalities that we're tackling. We also, as I say, need to get those ONEG donors in. What we're trying to do, and we heard about post-donation testing, we're also trying to do a lot of ABO testing before donation, because the other downside of a large donor base is that you don't need all of those donors, unfortunately. You may need a large donor base to be agile, but the reality is you want the high priority donors. So we're starting to do a lot more testing in home test kits. How do we build that into the registration and onboarding process so that we can understand what blood type you are once you've tested at home? Can we scan your fingernails to get your HB levels and start to manage HB outside of the donation process, so that when you arrive at the front door, you're ready? And that's our donor readiness program. How do we make sure that we capitalize on every donor that turns up on the donation that we take? And then we also have the interesting point of trying to grow our plasma business. So CVP was hugely successful for us. We've now been given the go-ahead to collect plasma for medicines. So we've started with 3 sites this year, and I think when you look across the world, right, plasma is going to take off for us, and we're very conscious of that. But at the moment, we've basically got a group of rugby players donating plasma, because convalescent plasma is all focused around, really hench-like, men to be able to donate. So we need to switch that up. We've just implemented some really great new machines that are much more female-friendly, that will enable us to broaden that donor base. It also gives us the opportunity, as I say, with the likes of the AB+ females, to move over to plasma as opposed to whole blood. So we're starting to build the technical infrastructure, the digital experience, to start migrating donors across under a program we call One Donor, so that we're able to manage that. And that also goes across the plasma base as well. But it's an exciting opportunity to be able to grow multiple bases at the same time for us. And then finally, always have to talk about people, and everybody says this. Virgin was the worst at this. People are what make an organisation, and people say that because it is true. So massive thanks to our teams for getting us out of amber within 4 weeks. When the chips were down, everybody came through. But not only do we want to grow and diversify our donor base, we also want to make sure that we're driving the diversity and growth for our people. Sue talked about the fare changes, and Xavier, our poster boy, for the fare changes. It's hugely important for him and his partner, having worked for NHSBT for many years, to be able to be a blood donor. We also want to continue to grow that through our networks, as mentioned about some of the transgender opportunities that we've got. And I think it's fair to say, in being honest and transparent, there is work that we can do in our diversity and inclusion at NHSBT. I think there's enough insight out there for us to understand where some of our pitfalls are and where our opportunities are. And I just want to sort of be super clear on our commitment to making sure that we drive that diversity and inclusivity for us as an organisation, not just our donors. So that was a whistle-stop tour from me, pretty broad, less data-focused, but hopefully gives you a flavour of what we're up to over the next coming years.
Thank you very much, Mark. We had discussed having a panel discussion, as it says on the agenda, but as time moved on, we allowed a little bit longer for questions.
Everyone's
so I
hungry.
think we won't have the panel, but whatever questions are for Mark just now.
Hi. Oh yeah, it's working. Yeah, I just wanted to say that really, really interesting talk. We too would have a, inverted commas, older donor population. And I guess what I'm kind of learning here is that we need to diversify the donor population, but potentially diversify the marketing strategies to attract those younger donors. I guess I'm just wondering if you might comment on that, around that, because it seems to me as if we're able to get these really good donors that are coming in for a long time, but the younger donors we're having more trouble contacting and getting the information to.
Yeah, absolutely. I think that's where I've been able to proactively, hopefully, challenge in terms of the way that we communicate, the way that we engage with our donors. So, we still use titles. Just as a random example, it's Mr. Mark Croucher, and it's like, nobody calls me Mr. Mark Croucher. Let's ditch some of that formality that we don't need. When we think about our loyalty events and our badges and program, it's very much geared around, again, I like to be harsh to try and provoke that reaction, but it's like a bad wedding. It's sort of, everybody's sat having some sort of bread rolls and a soup, and like, how do we bring some modernity to donation that is going to start to bring some of those younger donors through, be in the place where our younger donors are going to be, and as we talked about, getting right early. So we had this conversation this week around kids coming with their parents to donate. There's huge risk in that. So that's the first starting point. There's risk in having children on session when somebody's donated, and it's like, hang on a minute, that's your future donor there. We should be putting that child in the chair to see what the chair's like. How do we flip the thinking in terms of there is obvious risk, but how do we start to bring some of our younger donors much more forefront to our thinking?